Well, flat feet can cause lifelong pain and a loss of mobility that leads to other medical complications like diabetes and heart disease. But a Southeast Texas podiatrist has developed a surgery that corrects the problem, even in kids. Tom Wright shows us the results.
Well, we've all heard of flat feet, but if you don't have the condition, you may not know much about it. And if you do, you've probably been told that there's not much that can be done. But we're with a doctor here at Victory Hospital, Dr. Mark BRUYN, who's pioneered a surgical procedure to correct this problem. And it's really transformative for people who have this.
Exactly. Many years ago, my father suffered from chronic flat foot and was told that the only thing that could be done was orthotics or inserts to go into his shoes. He ended up having a career change as a result of that and became sedentary, gained weight, secondary diabetes, heart issues. One of the driving factors why I went into podiatry was I wanted to see if there's something that could be done to correct that, and over the course of my training and the first 5 years of practice, we developed a combination procedure that has amazing results without fusing the bones in the foot, which was considered to be the standard of care back when I trained 30 years ago.
Now, of course, you lecture on this, you've co-authored a textbook on it, you try to get this word out here about this, and you've shown us some patients today and their feet. And when you see the before and the after, I mean, it's quite startling.
Yes, and so for many years, pediatricians and parents have been told that the only thing that can be done for flat foot or the treatment of flat foot is inserts in their shoes called orthotics. Unfortunately, those orthotics are not well tolerated by the severe end-stage flat foot. And let me preface this by saying that 10% of my patients that I have flat feet or treat for flat feet end up undergoing surgical correction. 90% can be treated conservatively, and that always has been and always been my first approach to it. But when a severe morbid bowel deformity shows up in my office and it's referred by a doctor who's attempted conservative care without success, then those are the patients that typically qualify for surgical correction.
So it's a procedure that it's done over time. It takes a while to recover. It's not something you walk in and walk out one day. It's more of a year process, really, right?
Absolutely. No, it is outpatient surgery, but we do 4 procedures simultaneously. And I think you've seen earlier some of the severity or morbidity of some of these patients that we deal with. And as I said, this is one of those situations that the surgery takes place in one day, the healing takes place over a year. But once it's healed and once it's fixed, it's fixed. My revisional rate on this type of surgery over 30 years is less than 2%.
Wow. Well, thank you, Dr. Mark BRUYN. If you have any questions, you can contact with the office here, get more information, and it may not be something that you have to live with.